how do you think the dental industry is changing?
Well, dentistry is, in my 40 years, has gone through a number of different seasons. When I first started in the early 70s, it was so much about being a healthcare professional. And so there was more of a holistic approach to how we looked at patient care, and dental materials were being designed around that. Aesthetic dentistry came into vogue, and we sort of moved away from prevention, if you will. We sort of moved more towards, the kinds of products that had more of an aesthetic appeal, and so the common good of taking care of large populations and things like that sort of was set aside, while we worked on the things that made money. And there was a lot of money being made in those days of aesthetic dentistry. And we're sort of coming back now because the reality of treating, population bases is really in our faces, and we're realizing it because more and more as we progress, we're seeing that the treatment of the patient is not necessarily progressing in terms of longevity. There's an assumption that when a patient comes to the dental office, whatever they're going to have done is going to last a long time, or maybe even forever. And that's the way it was when I first started in the dental industry. But, amalgam has sort of around the world gone. There are certain countries in Scandinavia where it's banned. In the United States, very few dentists are placing amalgams because of either patient risk or environmental risks and so on and so forth. The only alternative was composite resins, and in many respects, if you look at the research today, what's happening with these chemistries, we may have gone kind of from the frying pan into the fire, not knowing what we were looking for an alternative, but did we find the best alternative? Because many studies, in the National Institute of Health in the United States are showing that the average life of a composite is 5.7 years. Numerous studies are starting to point to this. And the problem with failure is, it gets worse. You have to go back every 6 years or 7 years, to have that same restoration replaced. And sometimes the restorations are bigger and deeper. And so we're sort of caught in a vicious cycle now. And so I see more and more of research and a growing entity, especially among younger dentists, to try to solve this problem. And I'm really excited by that. And it's one of the reasons, I'm really staying in the industry is because I see this change coming, and I feel like I can help mentor it, not from a product standpoint, but from a philosophical standpoint of how we can bring better treatment to our patients. So I think it's an exciting time now. I think that many of us in the industry are seeing that there's an answer and that we can head in this direction. And so I feel very fortunate to sort of be a part of all of this, not just a leader in it. I'm more of a servant leader trying to usher in this new thinking, if you will.